In this video, we're going to cover how to train the most common underactive muscles. So let's get right into it. So when you squat, if you have this forward lean like I'm demonstrating right here, one exercise that could help you out is strengthening your anterior tibialis. So when performing this, take a cable and try to point your toes toward you like I'm doing right there. Make sure you do not bend your knee, but keep your knee straight. Make sure you don't flex the hips, but keep them in a straight line with the lower back and thighs. And don't lift that head off the ground. And if the foot starts pointing away from you, it's probably too much weight. So if your knees move in like this when you squat, one thing that could help you out is strengthening the hip abductors like I'm doing right here. So you can use a cable here and then move that hip and foot out to the side. So make sure the hip doesn't flex like this and the knee bends. Make sure the hip doesn't externally rotate like that with the feet turning out. And make sure the hip does not flex. So make sure it doesn't move in front of you. So if you notice that your ankles roll over like this when you squat and your hips are excessively externally rotated, I would recommend you do this exercise right here. Here we got pure hip internal rotation. To perform this exercise right here, attach a cable to your foot and move the foot to the side of you by internally rotating that hip. Do not move those knees apart, but keep them together. Make sure you keep that knee at a 90-degree angle. Do not extend it or flex it too much. And make sure those hips do not come off the ground. If you have an anterior pelvic tilt, that form of bad posture right there, one thing that could help you out with this is strengthening the gluteus maximus. So the hip thrusters here could help you out a lot with that. When performing this exercise, make sure that the knees don't move in, that the feet don't turn out or ankles roll over, specifically that the hips don't excessively externally rotate. But make sure that the knees and toes are in line. Make sure that the heels don't come off the ground, but that you push in with the heels, and make sure you keep that lower back straight. So these are all the most common underactive muscles, but this does not mean that muscles underactive for you. We're all different. We all have different individual needs. To find out what specific muscles are underactive for you, go watch my video there in the top right corner, and it'll lead you to my playlist, which explain to you how to assess yourself and find your individual needs.